Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to be covering separation anxiety. And this video is part of an NCLEX review series over pediatric nursing. So let's get started. Separation anxiety occurs when a child is separated from their main caregiver. So in other words, that main caregiver is removed from the sight of the child. This will cause the child to become very anxious, they do not like it, and they'll become distressed and act out. Now, unfortunately, this is a normal part of childhood development. Almost all children will go through some form of separation anxiety, but the severity and the duration can really vary among children. Some children can have this for quite a while and it can be very intense, while other children, they may have it a little bit and then they get over it really fast. Now, who does this main caregiver tend to be? Well, it's going to be someone that this child has formed an intense bond with. It's going to be someone that provides majority of the care to the child and is with the child majority of the time, because this child associates that person with, you are my security, you're my safe place and my comfort, my nourishment, and if you're gone out of my sight, life is not good and this is bad and I'm going to sound the alarms. So it typically tends to be the mother, but it can be anyone, whoever's really formed that bond with that child. Now, what are the triggers of separation anxiety? Well, it's anything where the child is separated from that main caregiver and they can't see them. It can be as simple as putting your child down for a second, let's say in a playpen, and going in another room to quickly do something, and they can sense you're not there, they will cry. Or it can be like dropping them off at a daycare or with another person to watch them for a while. They can start to have this anxiety. Now, why does it occur? When does it start and end? Well, it typically tends to be in the most full effect with its intensity around 10 to 12 months. But you can start to see it coming on in some children earlier, around 8 months of age. And why is this? Well, this is the time where most babies start reaching that milestone of object permanence. And this is where they have finally figured out that, hey, although I can't see this object, I know it's still there. So objects, hence, are people as well. So to that child, you're not there and they can't see you, but they know you still exist, and they don't like that they can't see you because they want you back, because again, you're their comfort, you're their nourishment, you're their safety. So they don't like that, and that is why they start to become very distressed. Now, as a parent of a young child who is about 8 months, I'm starting to experience with my child this separation anxiety. And I started noticing around 7 months of age that he all of a sudden liked to play peekaboo. He was starting to get the concept of it and really enjoyed it. So that tipped me off, hey, he's starting to understand object permanence. Now, about a week or two after that, I noticed that if I wasn't in his sight of vision, especially whenever he was really hungry or tired or just wanting to be cuddled, he started to have this separation anxiety where he wanted me, started crying for me, and whenever, I'd reappear or I would grab him, he would be content and fine and everything was well. And I am that one person that he wants. And so, if he is tired or hungry and my husband's holding him and he can't see me, let's say I had to go do something for a second, he will really start crying loudly, start protesting, wanting mama. And then whenever I come back, he's all better. Now, typically, separation anxiety starts to end anywhere between 2 to 3 years of age. So with separation anxiety, there are various stages, and I would definitely be familiar with these stages and how the child presents in each stage. So the first stage is called the protest stage, and this is where that child has detected, hey, my caregiver is not there and I don't like this. So this is where we start out at. And the child will start crying very loudly. They'll be hard to console. They'll probably push you away. They'll be looking or may even run to where the parent was last seen. Now, most kids will stay in this stage. They're not really going to progress to the next stage that we'll talk about here in a moment, because the absence of that caregiver is very brief and it's not extended. But if it is extended for a long period of time, they can go to the next stage, which is called the despair stage. And in this stage, the child is depressed, hence they're despaired. They're no longer crying, but will be withdrawn and quiet. They're not going to really be playing with others or even wanting to eat. But when that caregiver finally does return, they will still have that bond with that main caregiver. They may run back to the caregiver, cry when they see the caregiver, and be comforted that way. And then the last stage is the detachment stage. And it's actually rare for a child to get to this stage, but we don't want them to get to this point because it actually affects the child and parent relationship. Now, to you, when a child enters this stage, it may appear that the child has coped with the situation and they're happy they've returned back to normal life. But in reality, they've actually just detached themselves from the caregiver in order to cope with their absence. Now let's wrap up this review and talk about the nursing considerations for a child who is having separation anxiety. And this is going to focus on a child who is hospitalized because that's really where you're going to see it, and those education pieces for the parent. So to help us remember those main points, let's remember the word comfort. So C is for consistency with alternative caregivers or nursing caregivers. So whenever the child is hospitalized, you want to make sure that they are getting consistent caregivers so they can develop that trust and that relationship with the caregiver to help decrease that anxiety. And for the caregiver, let's say the caregiver has to leave the child while the child's being hospitalized, they want to make sure that they are consistent with how they depart, because children, especially whenever they get a little bit older, they love consistency because it develops familiarity. And that leads us to O, for objects of familiarity, to keep with them, especially when hospitalized. So you can encourage the caregiver, to bring something from home that the child can have, which can help hopefully decrease anxiety and try to keep things a little bit more normal. And then M, for maintain the presence of the caregiver with the child during hospitalizations and procedures if possible. And then F, focus attention elsewhere until the caregiver returns. So just help distract that child until their caregiver does come back. And then O, organize separation times when the child will tolerate it best. So it's best to avoid separating the child from their main caregiver whenever the child really can't tolerate it, like whenever they're hungry or they're hurt or they're sad or something else is going on. R is for reassure the child the caregiver will return when asked. And depending on how old the child is who is experiencing separation anxiety, you want to not give a specific time because children don't understand time, like, oh, they're going to be back at 9 o'clock. Instead, talk about like an event that the child understands, like your mother will be back after you eat dinner and you watch cartoons. And then lastly, T, train. So children who are really going through these intense separation anxiety periods, you want to maybe educate the parent that they want to have practice runs of separation with the child. Like start with short separations and then increase the time. And hopefully this will help the child understand that these separations are temporary and you do come back. Okay, so that wraps up this review over separation anxiety. And if you would like to access some quizzes that will test your knowledge on these child developmental milestones, you can access the link in the YouTube description below.